Welcome to Understanding How to Navigate the Health System, a Guide for Citizens. My name is Christina Madison, and I'm a scientific lead at the McMaster Health Forum. I'll be walking you through Module Number 5, the building blocks of the health system. The voice of citizens in their own care is protected through a requirement that they give their informed consent to treatment. Processes are also in place for their voice to be heard in how programs and services are delivered, the system's performance is monitored, and policy and organizational decisions are made. The Ontario government has the authority to make a number of decisions about how the system works. However, they also delegate some of these decisions to other organizations, such as the ones that regulate what different types of professionals, for example nurses or physicians, can do, and the local health integration networks that plan, integrate, and fund care in the province's 14 regions. Many of the organizations that provide care are private organizations, both not-for-profit, like most hospitals, and for-profit, like community pharmacies and the facilities that perform blood tests and x-rays. And they have a lot of discretion in how they operate.
Governance arrangements determine who can make what types of decisions. In Ontario, elected politicians are the ultimate decision makers, particularly those who are members of the governing party if we have a majority government, and especially the subset of them who are members of the cabinet. The Minister of Health and Long-Term Care often has the delegated authority to make many decisions. A nonpartisan public service, reporting to the Deputy Minister, is responsible for advising elected politicians and for implementing their decisions, and only occasionally for making certain types of decisions on their own. The government also has decentralized some of its decision-making authority to government agencies, professional regulatory colleges, and health organizations.
As noted, these other decisions broadly relate to other important aspects of the Ontario health system, where care is delivered and who delivers the care. These two aspects of the system are the building blocks upon which the entire system is based. Other important building blocks include specific financial arrangements within the system, which were mentioned in a previous module. When we consider where care is delivered within Ontario, we need to consider two things. First, the places where care is delivered, for example hospitals, and second, the supports for that care. Examples of these include electronic health records, systems to collect and analyze data, systems to apply the best available research evidence to improve the system, and systems to develop clinical practice guidelines. Some of the places where care is delivered is planned for and financially supported by the government. Examples of these include community care access centers, private not-for-profit hospitals, and local public health agencies. Other places are not financially supported by the government or are indirectly supported with government funds. Examples of these include community support service agencies, most primary care practices, and independent health facilities. Technology is used to support the delivery of care in two ways. First, Telehealth Ontario, which is used to assess a health problem and provide advice, but not diagnose or prescribe treatment. And second, telemedicine, video conferencing to provide clinical care at a distance through the Ontario Telemedicine Network, as well as through an increasing number of patient portals that provide patients with access to their personal health information. Charitable donations can be used to support both the places of care and the supports for care, but often not ongoing operating costs.
Infrastructure in the health system includes the places where care is delivered and the technological and research infrastructure that supports the delivery of care. Places for care delivery can include clinics, community support service agencies, hospitals, pharmacies, long-term care homes, and public health agencies. Supports for this care can include information and communication technology such as the telemedicine system that is run through the Ontario Telemedicine Network, and the many centres and agencies that support research to sustain and improve the health system, such as the Institute for Clinical Evaluative Sciences that produces data reports that identify problems in the system, and Cochrane Canada that produces high-quality syntheses of research evidence.
Primary care is accessed in two types of settings. The first is the clinic, where primary care is delivered by family physicians or by teams of providers such as in family health teams. Community health centers, nurse practitioner-led clinics or family health networks. The second access point for primary care is through sites that provide targeted services such as pharmacies, Aboriginal health access centres and birthing centres. Access to such primary care varies across the province, with the lowest utilization rates in the northwest and northeast of the province and the highest rates in the southeast. Other care access points include community support service agencies for home and community care, hospitals, independent health facilities, and out-of-hospital premises for specialty care, community physiotherapy centres, and rehabilitation hospitals for rehabilitation care, long-term care homes, and local public health agencies.
Over the last decade, there have been significant increases in the number of health workers, with particularly noticeable increases among midwives, social workers, and dental hygienists. The majority of Ontarians are registered with a primary care provider. However, less than half report that they are able to see their family physician the same or next day when they are sick. Ontarians living in rural and remote areas continue to experience difficulty in accessing family physicians as well as specialists, despite increases in the number of physicians in the province.
While the large majority of Ontarians are registered with a primary care provider like a family physician, less than half of these individuals report being able to see them for same-day or next-day appointments when they are sick. Across Ontario, there's a lot of variation in access to regulated health professionals like family physicians and nurses, with recruitment to rural, northern, and remote communities being a particular challenge. In terms of care in the home or in the community, many citizens will be familiar with personal support workers who work under the supervision of a registered nurse and provide a range of personal support services, including help with eating, dressing, and grooming.
There are 28 regulated health professionals who provide care in the province, as well as a number of unregulated health workers, such as personal support workers or paramedics. Regardless of which category the health provider falls into, whether they are a regulated professional or an unregulated worker, there are mechanisms in place to ensure the safety and public interest of Ontarians. The two largest regulated health professions are nurses and physicians. Keeping track of the number and location of these professionals, as well as the province's future professionals, is critical to addressing the changing health needs of Ontarians, especially in certain geographic areas where it's been historically more challenging to attract health providers. It is equally important to consider how the scopes of practice of these providers might complement each other and what changes can be made over time to improve access to meet the future needs of Ontarians.
The building blocks of the Ontario health system are the places where care is delivered and the people who deliver that care. The places can be directly supported by the government, like a hospital, or not directly supported, like a primary care practice. These places are further supported by technology and charitable donations. The people that deliver the care are made up of many different fields and specialties and are paid in many different ways. We are at the end of the module, and up next, we'll cover how you can advocate for change within the Ontario health system.